For my global health project, I did the biggest health problems and what is being done, and I chose to do obesity and overweight. The five key points that I want you guys to learn throughout the presentation is that obesity is more than a cosmetic concern. It increases the risk of getting illnesses and or diseases. There's more than one reason why a person may be obese: genetics, environment, and diet/exercise. A small amount of weight loss can improve the risk of potential diseases. Changing your diet behavior and exercise habits. BMI or body mass index can provide a reasonable estimate of body fat, but it does not directly measure body fat. So like an athlete can have the BMI of an overweight person, but they do not have the excess fat. And obesity can affect anyone at any age. For terminology, I have 4 terms for you to learn. So BMI is body mass index, which is a person's weight in kilograms divided by the square of height in meters. A high BMI can be an indicator of high body fatness. So what you want your BMI to be is 18.5 to 24.9. An overweight BMI is 25 to 29.9. An obese BMI is 30 to 39.9, and severe obesity is a BMI greater than 40. For organizations, there is World Obesity Federation, which is a group that brings together doctors from around the globe specializing in surgical interventions for dangerously obese patients. The International Federation for the Surgery of Obesity and Metabolic Disorders is a group of people that bring together doctors from around the globe specializing in surgical interventions for dangerously obese patients. RTI International assists governments and organizations around the world with its research into the costs and approaches to obesity on a societal level. An Obesity Action Coalition, with more than 50,000 active members nationwide, this organization supports people struggling with obesity and promotes an understanding of obesity as a disease. For populations involved, I have a lot of quotes that help make you understand truly who is involved. So the prevalence of obesity was 40% among young adults aged 20 to 39, 44.8% among middle-aged adults aged 40 to 59, and 42.8% among older adults aged 60 and older. From 2000 to 2018, the prevalence of obesity rose 11.9%, and severe obesity rose 4.5%. World obesity rates have tripled since 1975. In 2019, 38 million children were obese under the age of 5. And then in 1995, there was an estimated 200 million obese adults worldwide and another 18 million under 5 children classified as overweight. As of 2000, the number of obese adults has increased to over 300 million. And then 3 more. I have the prevalence of overweight and obesity in Latin American children is also remarkably high at 16%. It ranges from more than 12% for girls in Chile. And then it says the highest prevalence of obesity in children is found in Chile, which is 11.9%, in Mexico, 10.5% in boys. Non-Hispanic blacks, 49.6% had the highest age-adjusted prevalence of obesity, followed by Hispanics, which is 44.8%, non-Hispanic whites, 42.2%, and non-Hispanic Asians, 17.4%. In the Middle East, Central and Eastern Europe, as well as North America, has higher prevalence rates of obesity. For current trends, the prevalence of obesity did not change much from 1960 to 70, but it drastically changed from 1980 to 2008. 13.4% in 1980 to 34.3% in 2008, which is up by over 20% in only 28 years. Those rates are in adults, but the prevalence of obesity also rose from 5% to 17%. Similar increases in the prevalence of obesity have been reported in developing countries such as England and in countries where obesity was formerly rare. And the last quote is the prevalence in China among preschool-age children living in urban areas has increased from 1.5% in 1989 to 12.6% in 1997. Current issues. So the main issue is that there's consequences to being obese. So Obesity is second after tobacco for deaths for people per year over the age of 70. Death rates for tobacco are declining, while the death rates for obesity is rising. So it can pretty soon be number one for death rates, or for death causes. It is closely linked to heart disease, stroke, diabetes, high BP, unhealthy cholesterol, asthma, sleep apnea, gallstones, kidney stones, infertility, and as many as 11 types of cancer, including leukemia, breast, and colon cancer. 1 in 6 children is obese. It can also cause pregnancy problems such as high blood pressure during pregnancy, high blood sugar, and increased risk for a C-section. And more than 87% of people with type 2 diabetes are obese or overweight. The timeline of obesity. So, being obese or overweight used to actually be a symbol of like prosperity and wealth for men and women. In many areas in the Stone Age, such as Egypt, the ideal body shape would be considered obese today. Fatness was a way of freedom in the BC area. Throughout the world, obesity is considered a sign of success. And then it was also a sign of power during the Renaissance era. It was seen as successful because it meant they did not have to work in the field or in mills. Predicting the future for obesity or overweight, linear time trend forecast suggests that by 2030, 51% of the population will be obese. The model estimates a much lower obesity prevalence of 42% and severe obesity prevalence of 11%. If obesity were to remain at 2010 levels, the combined savings in medical expenditures over the next 2 decades would be $549.5 billion. And the study estimates a 33% increase in obesity prevalence and a 130% increase in severe obesity prevalence over the next 2 decades. If these forecasts prove accurate, this will future hinder efforts for healthcare cost contaminants. So now I'm going to be comparing obesity to HIV and AIDS as well as diabetes. So for similarities, there is both over 1 million people with HIV and AIDS or obesity. Both are preventable and both are in the top most common causes of death. And the difference between them is HIV/AIDS is more common in men, while obesity is more common in women. AIDS has symptoms of weight loss, and obesity is obviously weight gain. And more people die from obesity than HIV and AIDS. And comparing obesity to diabetes, the similarities are obesity can cause diabetes and diabetes can cause obesity. Both can end up with death, and you're more likely to become obese or develop diabetes when you are 40 or older. And the difference is obesity does not cause type 1 diabetes. You can get diabetes even when you are regular weight, and diabetes can cause rapid weight loss. So now you guys can play my Kahoot, and then here is my references. Thanks for listening!